Well, thank you so much for your time. My name is Mark Oldham, and I'm an assistant professor of psychiatry at the University of Rochester Medical Center and treasurer of the American Delirium Society. And this is not the kind of talk I usually give, and I think that will become quite clear in just a moment. But I want to begin with this idea of harmony in relation to delirium. The first application here is that the idea that delirium is itself a state of disharmony. So the person with delirium is not thinking or behaving harmoniously. The second application concerns the mind-brain system. Now, we know that the mind and brain are related, and we're going to explore this in just a moment, but the relationship between the mental disturbance of delirium must be properly related to the underlying physiological disturbances in the brain itself, which we call encephalopathy. And so we need to have not only harmony within the mind, but also in terms of how we understand the relationship between the mind and the brain itself. And so by extension, the relationship between delirium and encephalopathy. So it's no secret that the mind and brain are connected. The brain generates the mind, and the mind can influence the brain. But it's complicated. It's also quite clear that the mind is not made of matter, and so it's invisible, whereas the brain is made of matter, and so it could be seen. Of course, it's in the calvarium, and so it's not obviously seen, but it is physical. One could see a brain. But there's a fascinating paradox here that we're going to come to appreciate in just a moment. But for now, I'm going to put a pin in that idea. Now, as far as the brain and mind are concerned, I think most people tend to favor one or the other, and they secretly, or perhaps not so secretly, root for their favored one to win. But I think we should ask ourselves a pretty simple question, which is, what would it look like if either side actually won? It would be a pretty Pyrrhic victory. I mean, what would a brain be without the mind, or the mind without the brain? Modern philosophy continues to explore the seemingly inscrutable relationship between the mind and brain, or here on this slide, the mind-body problem. In fact, modern scholarship recognizes a variety of discrete, parallel mind-body problems. It's not just one. This figure here comes from an article entitled "The 5 Marks of the Mental," which I think is extremely fascinating, but it's not what you'd call light reading. And so perhaps if we inject a little bit of levity into this discussion, we don't have it all figured out yet, but we know the answer isn't phrenology. So the pseudoscience of phrenology had a sizable following in the 19th century, and it taught that you could tell a person's personality, their character, and so forth from ridges and the shape, the scalp. Actually, we get our words highbrow and lowbrow from phrenology. But again, this is pseudoscience, and it's not how things work. So this all might be interesting in theory. So let's get back to our main topic here, which is delirium. Now, we talked about the mental disharmony that is the experience of delirium, but so many words have been used to describe this single thing, and there's tremendous disharmony among them. Now, there's also a disharmony about the words that we use to describe encephalopathy, and there's essentially no overlap, much less harmony, between the words that describe delirium in the prior figure and those here that center on the term encephalopathy. And so in some ways, it can feel like these two ideas are perched atop two facing rock cliffs. And so here in this picture, depicted by what I think is a grass-covered fjord with a river running between the two, it can all seem a bit precarious or uncertain. I mean, how do we bridge this chasm between them? Or perhaps using a different analogy, we can think about all the many different aspects of these conditions and how they might fit together. I mean, we have a sense that they do fit together in some coherent fashion. When we look around, we see people, think about ourselves, thinking and acting perfectly reasonably. And so we presume that brains and minds tend to get along with one another pretty well in the main. That's how it's supposed to work. And we do want to put things together because we know that they should and can fit together. That when the pieces are arranged appropriately, that we'll have a functioning system. Here in this figure, a timepiece, perhaps even an elegant one. But let's again get back to delirium and encephalopathy. So here on the left, we see that encephalopathy is in the brain. It describes the pathobiological changes in the physical substrate of synapses in electrochemical networks. On the right, we see delirium and its broader spectrum from subsyndromal delirium to delirium. And you could include coma here for completeness sake on the far other end, if you will, of delirium. Delirium describes a mental disturbance encountered at the bedside. And yet this is the paradox I alluded to earlier, namely that the brain can be seen, but encephalopathy can't be. It's invisible. You know it's there only based on the effect that it has on the person. On the other hand, the mind can't be seen, but delirium can be. That is, the mental state of delirium is directly observable at the bedside. We see the changes in behavior, change in arousal, the life interruption that it invariably causes. And so let's think about this in terms of a rope. Every rope has two ends, regardless of its length. And so it is with delirium and encephalopathy. They are two ends of the same rope. Delirium cannot exist without an underlying encephalopathy, nor can encephalopathy exist without the spectrum of mental states that it produces. And so as a personal reflection, we all want harmony in our lives and our families. I mean, I certainly do. And we who care for patients want harmony in our patients' lives as well. And in terms of delirium and encephalopathy, we have a bit of work yet to do, and it will take time. But this is so important that we must get it right, not simply for the love of harmony as an abstract idea or some philosophical aim, but because the mind and body are indeed deeply connected. And I'm convinced that if we were all a part of one broader symphony of care, playing harmoniously together rather than solo artists playing our own sheet music or hosting rap battles, if you will, that we would all play a far richer score for our patients, by which I mean they would receive far better care. And isn't that what we all really want?